Thank you for joining. We're happy to see you this morning. Thank you all for being here. It's great. As you know, our theme for today is Be the Change. You are the change. And one thing that I really want to emphasize about this is you may just drop a seed. Somebody else may come along and water, and then eventually we'll see a harvest in the clients that we serve. Today is your day. We want you to know that by you being here, you are making a huge impact. So we want to welcome our first speaker. Our first speaker is Bruce Vanderhoff, MD, MBA. He was appointed director of the Ohio Department of Health in August of 2021. Dr. Vanderhoff joined the agency after being named Chief Medical Officer in November 2020, and he has been a key leader in planning, managing, and executing Ohio's COVID-19 response, including its wide-reaching vaccination program. Dr. Vanderhoff also leads the effort to transform the landscape of public health in Ohio through programs and policies that strive to erase inequities, elevate the importance of social determinants, and improve healthcare access and outcomes. Before joining ODH, Dr. Vanderhoff had amassed years of experience leading large teams and successfully dealing with important healthcare issues in Ohio. He served more than a decade as a senior vice president and chief medical officer at Ohio Health, where he prepared the healthcare system to manage the threat of Ebola and H1N1. He also addressed pressing healthcare issues affecting Ohio from rural Appalachia to metropolitan Columbus. Dr. Vanderhoff's service has made him a nationally recognized physician leader with an impressive track record of managing large-scale healthcare initiatives, addressing disparities, and improving population health, all in alignment with HIO. His deep commitment to public service has been recognized through both the Phillips Medal of Public Service from Ohio University, and he's earned an honorary doctor of community leadership in healthcare from Franklin University. Dr. Vanderhoff holds a doctorate in medicine from the University of Pennsylvania and a master's of business administration from Franklin University. He completed a residency in family medicine at York Hospital in York, Pennsylvania. Join me in welcoming to the podium, Dr. Bruce Vanderhoff.
You forgot one thing, Tanika. He has the most impressive boat I can watch. It's awesome.
Well, thank you. Thank you for that very, very kind introduction. It really is a pleasure to start the day here with all of you. The work that our community health workers do is so important to the communities that we serve, but it's really essential to the mission of the Ohio Department of Health. And why is that? Well, it's for a whole variety of reasons. Probably first and foremost, the reality that you are trusted members of your community. You come to the table with a different kind of relationship with the people that we're reaching out to, the people that we're serving, than so many of the other members of the outreach team that we have. And you're bringing a broad range of lived experience into that engagement that you're having with the people that you're serving. I was having a conversation while we were waiting for everyone to gather. One of the things that we were talking about is how important it is that your work engages people very often in their homes. That's really essential very often to first understanding how that individual is really encountering and experiencing their healthcare. But it's also very often a really important component of building trust with them. And we know that trust is such an important element. Really what you're doing is helping us connect with the people that we serve. And that connection is just so important. You're providing education. We know that your work really is, in so many ways, the work of being an educator. And of course, you're helping people to understand and identify what health services, especially preventive health services, can make a real difference in their lives. And for so many of the communities across the state of Ohio, it is those preventive health services that really are among our most important challenges in terms of reaching them with healthcare that makes a difference. Because, you know, when a person is in crisis, most people know, well, you know what, things are bad right now, I better get to the emergency room. But when it comes to avoiding the problems that are going to lead to that kind of crisis, it's understanding the preventive health interventions for whoever they are at whatever stage of life, whether they're a mom to be or they are one of our seniors. And your work is just so important in achieving that. And your work also, though, in that vein, links very directly to the key programs for the Ohio Department of Health in terms of our mission and what we're trying to deliver. First and foremost, the beginning of life. And all of our work that is such a high priority to the governor around reducing infant mortality and specifically addressing some of the inequities that we see in the healthcare outcomes in our infant mortality, particularly in our Black community. Our breast and cervical cancer project, another very, very important one, where your work is helping to enroll more and more women. And when we think about preventive health services that have the opportunity to make a real difference, that's a big one. And your work is vital there. And while there are many others, the last I'll mention is our Coverdale Stroke Program, which of course is very important primarily for our older Ohioans who need to understand not only, look, what are some of the early signs and symptoms of stroke? Because you know what, stroke is not what it is today. It's not what it was when I was training. Stroke is like a heart attack, a condition we can intervene on. We have the opportunity to take someone who's having those very early signs and symptoms and deal with it before we have permanent damage. But we also have the opportunity to help them understand the lifestyle risk factors, the preventive health that can maybe keep them from ending up in that situation. Your work so vital to that. And then, of course, as they were mentioning in that very kind bio that was shared, COVID-19 has kind of dominated our work over the course of the past 2, 3, 4 years. And your work around COVID-19 has been essential for the outreach efforts of the Department of Health. For one, because you helped us have the kind of connections with the local health departments that are so important for the work that we do. You know, the Ohio Department of Health works through community organizations, especially the local departments of health. And you served as vital bridges in COVID-19 to that work. How? Well, through information and getting information out to the community, especially information about testing and the availability of testing resources, about vaccination and how to get vaccines, and important information about vaccines, particularly when understandably, am I not? Okay, sorry about that.
You can shout it from the rooftops.
Okay.
We love hearing how cool CHWs are.
Particularly when it came to issues that had to do with people's trust in the vaccine. So I think that that's all something that you should feel good about, but there's nothing like seeing the outcome of your work and seeing other people evaluate that work and say it made a clear difference. And we all have a recent study that I think should make you feel very good about the work that you did around COVID-19 that came out in the Lancet. And the Lancet, as you may or may not know, is one of the most prestigious of the medical journals out there. And what it showed was that Ohio really led the nation in achieving low mortality, that is a low death rate from COVID-19 when we adjust that rate on the basis of underlying risk factors, things you can't really deal with, realities that people have as they're developing COVID-19, right? So that's an important adjustment to make. And when they looked at that, Ohio was 8th in the nation. That's very impressive. And I'll tell you, I know that a piece of that, and a very important piece, was your work around education, around awareness, and around building trust. So thank you for that. Your work on so many fronts is just so very important. And so with that in mind, and recognizing just how important your work is, I have something that I think is wonderful to share with you, and that is a proclamation that Governor DeWine has issued and has signed, and I'm going to take a moment and read it to you, and then I will leave that with your leadership for your organization. But let me read this proclamation from the governor. Whereas community health workers are frontline public health workers who are trusted members of the community they serve. Whereas community health workers represent trusting relationships which enable them to serve as a link between health and social services and the community to facilitate access to services and improve service delivery. Whereas community health workers are well positioned to help improve health outcomes and address health equity for low income, underrepresented, and minority communities. And whereas community health workers also assist mothers in Ohio to ensure healthy pregnancies, births, and follow-up medical care. And whereas community health workers share resources and education about disease prevention and treatment, as well as management for those they serve. And whereas community health workers help remove obstacles to health and wellness for their community members, which helps ensure that Ohio remains a center for healthcare innovation. Now, therefore, we, Mike DeWine and John Husted, Governor and Lieutenant Governor of the state of Ohio, do hereby recognize Community Health Worker Day on this 6th day of June, 2023. So, congratulations to all of you. I think a very suitable recognition of your incredible work. And as I close, I just want to reiterate that you are essential members of the public health care team and really vital members of the Department of Health's outreach into every community in our state. And I am very, very grateful for the work that you do. So thank you and congratulations on your recognition.
Thank you, Dr. Vanderhoff. Well, we will frame this. We appreciate it. Hopefully everybody on camera saw it. Next up, I'm going to load a slide presentation. Our next speaker really, though, needs no introduction, but for those of you who may not be familiar with the fabulous Director Angela Dawson, or Ms. Angie, as we affectionately call her, of the Ohio Commission on Minority Health, I will read her bio here, and she's going to, I know, motivate us because we just heard from Dr. Vanderhoff. ODH has been a powerful ally and a wonderful friend. I will say Ms. Angie was with us before Hubs even started, in the beginning, in the trenches, building the model, and we are so appreciative to her as well. Angela Dawson currently serves as the Executive Director of the Ohio Commission on Minority Health. OCMH was the nation's first state office of minority health. First one, in response to the disparity in health status between Ohio's minority and non-minority populations. It funds projects which are innovative, culturally sensitive, and specific in their approach toward reduction of the incidence and severity of those diseases or conditions which are responsible for excess morbidity and mortality in minority populations. Prior to joining OCMH, Ms. Angie was appointed Director of the Ohio Department of Alcohol and Drug Addiction Services by then Governor Ted Strickland. She also served as the Executive Director of Project Linden, a private nonprofit outpatient alcohol and other drug treatment and prevention services center in Franklin County for 20 years. She is of us, for us, by us, and we are so grateful. Ms. Angie received her bachelor's degree in rehabilitation education and a master's degree in counseling and guidance, and a second master's degree in rehabilitation counseling from Wright State University. So without further ado, I'm going to put these slides in. Ms. Angie, we welcome you. Thank you for being here. To be on screen, you'll want to come around.
There is a song that really depicts the way I feel about you. I cannot sing. They only allow me to clap in church. For good reason. But there's a song that says, never would have made it without you.
Yeah.
In fact, Ohio would have lost it all. But now we see that you were there for me. Never would have made it without community health workers. Never, ever would have made it. You need to understand that I'm stronger. I'm wiser. I'm better. I'm so much better. I thought I would have lost it all, but you were there for me. You reached out to me. You made a difference for me. You interceded. You spoke up. You found a way out of no way. When all was lost and the world shut down, it was community health workers that were still around, making porch drop-offs, texting and FaceTiming to make a difference. You need to understand that you matter, your voice matters, your vote matters, and today is your opportunity to be heard. You have the proverbial return on investment that everybody is seeking. You are the one thing that we need in this state to ensure that individuals who have chronic diseases, individuals who are high risk and pregnant, individuals who simply are coming out of institutions to be reconnected, young people who need a way to college, anybody. In fact, I believe a community health worker would improve my family reunion. What isn't better with care coordination? And so you need to understand that it is a privilege and an honor to stand before you. We cannot, nor would I, take credit for the difference you have made. You are truly what we call the difference. You need to wake up in the morning recognizing the power that you have. I want you to take this advocacy day as a day to be heard, not a day to be denied. It's a day to say, yes, I want a livable wage. Yes, I want benefits. Yes, I want to be heard and respected within other institutions of service. Yes, I am a part of the team. Yes, I am the connection you've never, ever had and can barely get. Yes, I matter. Your voice matters. Your vote matters. You matter. Give yourselves a hand. So I'm going to try to get to this PowerPoint. Okay, so clearly you all know I did not pass. Okay. You know, this doesn't mean anything to me, right? Because you know I don't need a PowerPoint. I don't need a PowerPoint or a guided speech. I need you to hear me clearly. I need you to get your family members who see the sacrifices that you make. I need you to get the community members who know what a difference you've made in their lives. I need you to get them to speak about your value and about your work. Now, we do well at the state calculating. Dr. Ayez is right there. He can calculate to the penny the return on investment based on the interventions with individuals who are diabetic and are emergency room frequent flyers, and the ability for a community health worker to reconnect that individual, or and sometimes connect that individual to a primary care physician, and what an impact that has on the state's bottom line, because we know the devastating costs of diabetes to the state of Ohio and to the globe. And we know we have a return on investment on average $6 on every dollar invested. We are making a difference. Yes, we know you can make a difference. The commission has been fully vested in community health workers. Day one, because the commission has always known if we don't connect to the community, we don't have any business serving. It's the community connections that are going to make the difference. We know that the value that you provide to this state is immeasurable, because at the state level, you have to speak. Oh, I have to talk louder. Really? So sorry. Okay, I keep forgetting. I'm supposed to make sure. Hey, y'all, just when you know I miss y'all, give me a hug. All right. We know that we can calculate your value. We want the cost savings that you bring to translate into higher pay. We needed to translate into a meaningful, livable wage. We don't want to lose you. We don't want to lose you to marketing careers. So I'm saying stay. Work with us as we work with you, so that we can allow this to be the career ladder it is intended to be. What we cannot quite measure, and in some sense it doesn't need to be, what we can measure is the power of your impact in the lives of those you serve. When someone who didn't think they were smart enough to get a degree and you assisted them, and then the residual impact on their children who saw them get the degree after failure, and the impact of that having a trajectory for their future graduate, we can't even measure that you allow somebody to grasp the opportunity for health again in their lives. after they have suffered for so long trying to manage a chronic disease that has been embedded in the generations of their families, after they have watched them going and going to homegoing services, dying from the same diseases. So they thought they just had to take a number and wait in line. You have made a difference in helping people manage their chronic diseases, gain success in establishing a better health status for themselves. You've given them access to a home. Let's just pause. You have settled individuals in a home when they had been couch surfing, sleeping with whoever would allow them just a space on a couch or a floor. And you gave them that level of hope that you can't even measure what that does to a person's, how that stabilizes them for the future, how they build confidence on that, how they can hope again. When we talk about the work we do with those who are hopeless, and you replace that with a modicum of hope, that's immeasurable, but it's what you live for. It is that emotional value that I wouldn't even want to put some type of statistical analysis against, because you cannot measure heart. You can't measure care and concern. And yes, you absolutely are essential. And essential means an essential wage. Essential means that you are going to be acknowledged and recognized for all that you do. We want you to advocate. This is tough. I am a licensed counselor by profession. I'm a leader by choice. It is very difficult for individuals who care deeply and serve others to stop and have the ability to then make efforts to serve themselves. We struggle with it. Oh no, I'm fine. Let me just help her. No, don't worry about me. Sound familiar? You go ahead and pay attention to them. But there's a reason when we are on a plane, when turbulence in life hits and the oxygen mask drops, the instructions say, help yourself before helping others. Because we want you to be able to breathe. And we want you to be safe. And more often than not, the things you deal with hit so close to home because you know it could have been you. You know, you have lived these experiences, and some of you have been close to what you are now solving. But I want you to intentionally and strategically set aside time to advocate for yourself. This is a great day. We are here to advocate, but I want you to understand advocacy, as Miss Carrie Baker will tell you, is 24/7, 365. We do not wake up and say, oh, let's go intervene. No, these are strategic, intentional plans. And I want you to build your stakeholders in your community. I want you to recognize that there are stakeholders. You are a stakeholder because you're a community health worker. The people you serve are your stakeholders. The family members of the people you serve are your stakeholders. Your city council, your county commissioners, your state rep, and your House of Representatives, the U.S. House of Representatives are your stakeholders. Hospital systems are your stakeholders. FQHCs, stakeholders. Prison systems, stakeholders. Departments of health, stakeholders, state and local, city and county. Those are your stakeholders. And you have to approach them to say, what is it that we can do for each other? I've been working on your behalf. How are you doing? I've been making a difference in the work you do. How are you doing? We have to form champions and allies. And let me tell you, I don't care why people come to the table. I don't get caught up. I don't want people to be like me. I get sick of me. Okay? I want people to come to the table for whatever reason. Some people come because it's the right thing to do. Some people come because, oh, it's the passion of which we serve. And some people come because it's the economic thing to do. And some people come because they didn't know what you did anyway. And some people just come. Do not require people to speak your language. Believe what you believe. Do what you do in order to help you. We need to be able to be in a room at a table. There shouldn't be a city council meeting in your city that some community health worker is not assigned. There should be community health workers assigned to every policy initiative in every city you come from. The planning, every city has a planning council, a regional planning council. Every city has county and city commissions. Every city has a school board, every city. And you need to be present. The policies that are moving to health in schools, what is the role for community health workers? The policies that are looking at re-entry, what is the role for community health workers? The policies that are trying to reduce emergency room use and avoidable second readmission, where is the role of community health workers? The healthcare systems and the hospital systems who are discharging individuals, what is the role of community health workers? I'm so glad you asked. Well, let me tell you, community health workers are the ones that make the difference. They are those connectors to what we call those sure services. I know. We have to call it evidence-based care. But you call it sure services because you're sure when you refer them to that colleague that you know they're going to pick up. You're sure it's going to make a difference. They're sure services. When you come up here, you call them evidence-based services. Because here's what we have to recognize. Every one of your stakeholders have different interests. And let me help you. The way I speak to you is not the way I speak to legislators. I stand there and say, okay, let the spirit of Dr. that may be able to talk about the return on investment and the bottom line and the differences that we make. And the fact that in 2012, Medicaid had spent $313 million of their delivery care budget on a 14% return birth rate. And this is unacceptable. And therefore we must make a difference and we must invest in the hubs. And we started with 3 and now we have 12 across the state of Ohio. Give yourselves a hand. But I want you to be mindful that when you are engaging with a population, tend to their language. So if you came upon an individual that you did not speak English, you would automatically, as a community health worker, if you didn't speak their primary language, you would engage with an interpreter. Okay, good. You are in a place that needs interpretation. You need to be aware that when we say we want you to be culturally and linguistically competent, you need to understand you have to be culturally and linguistically competent when you are engaging with legislators and policymakers. And while many of them will want your story of how it made a difference, they are the fiduciary agents of this state. So their first language is return on investment. That is not a bad thing. It is the language they speak. So if you speak to them in a language they don't understand, don't be upset when you walk away confused. You have to talk about what matters to the audience you are in front of. So we can talk about the return on investment that we make, and that for every dollar you invest is a $6 return on investment. We can talk about the hubs that had a 50% reduction and special nursery care. And we know that neonatal ICU costs will down. We know there is a per member per month cost savings for medium, high, and low risk individuals who go through a hub who are on Medicaid. Did you care to hear a personal story, sir, ma'am? But be mindful that you are engaging with individuals who speak a different language. And you have to be mindful of how it is best to communicate. I want you fully able and capable of doing advocacy work. I want you to have the same proficiency you have when you are engaging and reaching out and connecting individuals to needed and necessary services. I want you to have that level of proficiency. I want in my mind's eye, I can see city council meetings, regional planning councils, county commissioners, board of education. I can see you there. If you do not speak, let me say it as my grandmother would, a closed mouth doesn't get fed. A closed mouth doesn't get fed. And if we don't say it, I have never seen an allocation for other. I just haven't seen it. You know, we have to do this, 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 and other. Other never makes it in the budget. I need you to put a face on what you are doing and the difference you are making. And then next year, when you come, you're going to bring checks made out to the state of Ohio that demonstrate your return on investment. And you'll have a cancer check, and you'll have a diabetes check, you'll have an infant mortality check. Yes, you'll have a reentry check, you'll have a school check, you'll have an education check, and you'll, depending upon that committee member you're meeting with, hi, ma'am and sir, you're with the education committee, just a second. This is the return on investment because you are making an investment in us, and ask for what you need. They need to hear from you how you are struggling to stay a community health worker. You want to stay, you want to do this work, but the rent has gone up. You want to do this work, but you're taking care of so-and-so's kids. You want to do this work, but you want to be able to be on a career path, but you can't afford to go back to school. You want to be certified, but the training opportunities are varied and it really doesn't accommodate your schedule, but you want to do this work. And then you say, now be ready for this. When someone asks you, what is it that you would want me to do? You're not ready for that. You came up here thinking, oh, we got to tell them who we are and what we are and how we make a difference. Somebody today is going to say to you, what is it that I can do? And you need to have a ready answer. You need to be ready to answer that question in a very real way that is measurable so they know if they made it or not. You know how when you open the pathway and you got these metrics, you know about it. And you said, oh, in order to close that successfully, I must do click, 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 right? You want to be able to say to a policymaker, to a legislator, hi, this is what I would like for you to do. We need a livable wage. And they go, okay, what would you like me to do? I would like you to introduce legislation. You have to have a step-by-step. Here's what I would like you to do. We would like to meet with members of your committee and talk about this specifically. We would like you to meet with the Hub Network who lobbies on our behalf. We would like you to meet with the Community Health Worker Network. Why? Because we know that many of the individuals that employ you, they know that they are relying on grants. Many of you may work for a healthcare system, many of you work for the hubs, many of you work in hospital settings, but you have to be able to talk about what needs to be done. And then you have to be able to cite the information. You have to have those bullet points that are going to help you to say, sir, madam, one of the areas that we work in is diabetes. And so we work with emergency room systems to deal with individuals who have diabetes, to connect them to primary care physicians so that they have a reduced cost in their entry into healthcare access. But the other thing that we know that you may not know that I would really like to share with you, that for every 1% that the A1C improves, oh, I don't know if you realize this, but there is a 21% improvement in what? Chronic disease. Or for every 1% that person improves, there is improvement in the liability and the possibilities of stroke and other cardiometabolic diseases. Just want you to know, for every 1%. And you say, Miss Angie, why do you use diabetes all the time when you talk to legislators? Why wouldn't you just use infant mortality every time? There's a little secret you may not know. The majority of legislators are male. The majority of legislators are over 50. The majority of legislators have family members older than them that are likely dealing with a chronic disease such as, I'm just trying to speak languages that they understand. See, if I've already graduated my children from college, grandchildren may be the closest thing that I have to an infant. But if you talk to me about diabetes and neuropathy, I know what that feels like on my feet. If I talk to you about heart disease and recovering from heart disease and making sure that you don't go back into the hospital, I may be able to relate to that. But again, we have to have relatable subjects so that we can say, here is the difference community health workers make in the bottom line, and then talk to them about something that impacts their health specifically. We know this can be done. How many of you are aware of the Health Policy Institute of Ohio Health Value Dashboard? Raise your hand. Look around the room. The Health Value Dashboard is a policy document that you need to be aware of, because the Health Policy Institute of Ohio has really made inroads with the General Assembly to help them to understand what social determinants of health are, to help them to understand Ohio's health value. Ohio ranks 44 in health value out of 50 states. Yes, Ohio. So when you are talking with legislators, you need to talk about Ohio's health value and how you are making a difference in improving Ohio's health value. So when we talk about health value, we mean population health and healthcare spending, how much we spend and how well population health is ranking. We rank 44 out of 50 with these stellar healthcare institutions in our state out of 50. This is something they are going to know. They need to know that you work in the areas of what we call modifiable factors. You work with individuals and you work in the areas of the social and physical environment. You work where change can happen. When they say, what do? I work where change happens. And how do you do this? By linking individuals to services that will improve their health outcome. Isn't that what you do? And what difference does that make? It saves the state money. You have to be able to speak that language, especially when you are talking about advocacy. A community health worker is the infrastructure in a community to coordinate care for any community member who is at risk. High-risk mothers, I can coordinate care. Diabetes, I can coordinate care. Stroke, I can coordinate care. Heart disease, I can coordinate care. Cancer, I can coordinate care. Mental health issues, I can coordinate care. Opioid issues, I can coordinate care. Yes, you're the infrastructure. You're that connection to the community. Know your worth. You've got to know your worth, because what you do makes a difference. How many of you have seen the 2018 Community Health Worker Assessment for the state of Ohio? Raise your hand. Look around the room. Look around the room. I see 5 hands. The Ohio Department of Health, okay, and the Government Resource Center made an investment to do an assessment of what was going on for community health workers. this is a document you would reference in your meetings. When you say the Ohio Department of Health report on community health workers is no different than when Dr. Vanderhoff said, whereas. See, I had these whereases memorized, so I could say Governor DeWine recognizes that we are frontline public health workers, sir, ma'am. Governor DeWine recognizes the impact we make. According to the Ohio Department of Health Community Health Worker Survey, you should be able to rattle off, this is what we do for the state of Ohio. We are a bridge to the community. Some may call us community health workers, we may be navigators, we may be a home visitor. We are called many things, but all of us, regardless of our title, make a difference. Then you would be able to say 90% of the work we do connects individuals to care. So these are the reports that you want to be able to reference. Oh, so what do you, I'm so sorry, ma'am, could you tell me the conditions that you address? Oh, certainly, ma'am, and sir, we address mental health issues, we address diabetes, we address cancer, cardiovascular disease, and stroke. You may have some family members and you know the difficulty when they are dealing with chronic diseases such as asthma or high-risk pregnancy or even obesity, because I know you already know the cost of obesity in Ohio, ma'am and sir. The language you speak makes a difference. You already know you're effective. You already know you're making a difference. Now I want you to tell others in their language why they need to invest more in you. So when we look at what the future of community health workers look like, we want you to be able to have a say in that through your advocacy work. We know that you make a difference in making social determinants of health something that is an issue, but you are able to connect people to resources. You don't get to wave a magic wand and make transportation issues go away, but you know how to navigate to get people to where they need to go. You know the on-the-ground barriers. Who do you say you are? Describe yourself. Give me some adjectives to complete this sentence. As a community health worker, I am, give me an adjective.
Resourceful.
Resourceful, and just so you know, I have a significant hearing impairment, so use your playground voice. So resourceful, community health workers are
Essential.
essential. Community health workers are resilient. Community health workers are supportive. I know, I love that. Community health workers are knowledgeable. Excellent. Community health workers are community health workers are community health workers are heroes. Community health workers are I know what they say about you. What do you say about yourself? What do you say about yourself? I want that ringing. I want those adjectives ringing in your ear. So when you walk in the office, you walk in with the knowledge of that is who you are. And oh my goodness, aren't you honored to meet me, ma'am, sir? You have to walk in who you are. You have to walk as though you know the contributions you make. You can tell when someone walks if they have confidence. They walk. I want you to own every room you occupy today. I want you to own it. And I want you to go in with the knowledge that you absolutely are making a difference. You need to understand your power. You need to understand that you have the ability to consult with a primary care physician team, with nurses. You have the ability to engage. You have the ability to do outreach and engagement. You have the ability to do coordinated care. You have the ability to connect the most difficult individuals that they have ever experienced, and you have the audacity to have success with them. These are the people, when they go in the ER, they go, oh God, they're bad. You deal with those individuals. Treat them with a level of respect they deserve. Lift up their bowed down head and connect them to the resources that they need. You advocate for those services because you know enough about the healthcare system to know what they ought to be receiving, and you can tell when it's not happening. You link the client to the community. They may hand the list, but you do the link. This is who I say you are. Who do you say you are? It is not our darkness that scares us. It is not that dark place that all of us can get to. That is not our deepest fear. No, baby. It is your light that is your deepest fear. Because somewhere you are afraid to shine. And you don't do the world any service in hiding that light. So what I'm saying to you is your voice matters. Your voice matters. Your vote matters. Your service matters. And your light matters. You go forth and do what you have always done. I'm simply here grateful that you let me come for the journey. You have a great day. Bring Miss Terry back up. Y'all give Miss Terry a hand, give all her staff a hand, give her a hand. Oh, thank you so much. All right, not a problem. I'll do that speech another day.
You recorded, love you.
Yeah, no, my teacher got a t-shirt.
Yeah,
what's up?
Gonna wear it all over.
Yeah, so, well.
Okay, so thank you again, Ms. Angie. Our next speaker representative for It was wonderful. So thank you for being
No, thank you for the
representative. I'm gonna
invite.
read
I
your
appreciate it.
bio,
Oh, please
yeah.
don't
And then
have-
we've got folks all over the state on our live stream. So
All right.
they're on video here. You'll come on over so they can all see you. Thank you, Director. Next up, we have a really fantastic opportunity to interact with Representative Darnell Brewer from the Cleveland area, District 18. Not only is he a freshman legislator who has shown his incredible passion for our work, and I'll talk about how in a second, he is also the first ever certified community health worker serving in the General Assembly. So I'm going to read a little bit of his bio here. So his district includes portions of Cleveland, including communities of Garfield Heights and Maple Heights. He's been serving as a social service coordinator for over 15 years. Throughout the years, he's held positions as an assistant administrator, parent liaison, wave mediation training and provider, and truancy officer within the Cleveland Public Schools. He's also provided case management and community reentry through CATS, which is Community Assessment and Treatment Services, for formerly incarcerated individuals. In addition, he has advocated and provided case management and CHW services for single fathers, drawing on his own experience as a single father. As an advocate, he has and will continue to fight tirelessly to ensure equitable treatment and opportunities relating to health and health equity, criminal and environmental justice, voting and education rights, and economic empowerment. He has served on the executive committee of several civic and community organizations, including the Cleveland chapter of the NAACP, the National Association of Community Health Workers, Carl Stokes Brigade, Southern Christian Leadership Council, and National Action Network, among other prominent organizations. What Representative Brewer really did for all of us in this room, and I cannot thank him and his staff team enough. One of the things that we are advocating for today, along with funding for the Commission on Minority Health, because of all the great work that Ms. Angie and her team does, is Representative Brewer really championed this idea of a Center for Community Health Worker Excellence within the Ohio Department of Health. He introduced, oh, thank you, Heidi. The blue sheet is what I'm referencing, and we'll go over it a little bit later, but we had 2 House champions, and Representative Brewer was the drafter of this amendment that did make it into the House budget process. And we are so grateful for your support and the funding, and really bringing together all of the various aspects of what community health workers do in hubs and beyond hubs, all across the state. So with that, I will turn it over to you, Representative. Thank you for being here.
Thank you. It is an honor to just stand amongst this group of people. It is truly an honor. Today we celebrate Community Health Worker Day here in Ohio. We recognize the invaluable contributions made by you all, community health workers, in the healthcare community, in your neighborhood, in your churches, in your communities, and how you serve. As community health workers, you understand that health extends beyond the confines of 4 walls, hospitals, clinics, neighborhoods, churches, community centers. You are embedded in every fabric of our neighborhoods, our families, and our daily lives. You bridge the gap between healthcare institutions and the communities that you serve, bringing healthcare directly to the doorstep of those in need. You are the trusted liaison, the advocates, the champions, and the holistic well-beers of your community. In every encounter that you as community health workers do, you embody the essence of care. You listen attentively to the concerns and struggles of individuals and families, recognize the unique challenges they face. With empathy and understanding, you provide them with information, resources, and support necessary to make informed decisions, not only for themselves, but their families, their communities, their co-workers, their neighbors, their friends. You touch every fabric of the lives that you teach and touch. You give support when it's time to make informed health decisions. You empower families and individuals to take charge of their well-being, foster a sense of ownership and self-efficiency. The role of community health workers is not just about addressing the immediate health needs. It's about building relationships and nurturing a sense of community. You connect individuals to a more extensive web of services and resources available, working collaboratively with healthcare providers, healthcare systems, healthcare barriers, breaking them down. You do so much when it comes to partnerships, social services, and community organizations. By fostering these partnerships, you create a web of supportive network that embodies individuals to access the care they need when they need it and at the time when they need it. Today, as we celebrate Community Health Worker Day, let's acknowledge our challenges, particularly when it came to COVID. And we know how COVID really hit our communities. You were out there on the front line. I can say we were out there on the front line. We witnessed the devastation impacted on our communities. The immense loss of lives, not just from our families, but our friends, people that you touch, people that you may have talked to one day and help maybe go on the next or place in the hospital. And you gave of yourselves to go out and still be that community health worker. That's why I'm standing here today as the freshman from District 18, being here as a legislator. That's why it's my role as a legislator. It's my responsibility to champion the work that you and we all do. We knew the strain it caused on our healthcare systems, but through it all, you stood firm. You adapted swiftly and tirelessly, provided care to those most vulnerable. Your dedication did not and still has not wavered because you're here. You travel here to Columbus. Not only talk to me, but the other legislators about things that you have encountered as community health workers. You will become the pillars of hope, offering solace and reassurance in the times of uncertainty. We embrace technology to those in isolation, offering virtual support and resources. We navigated barriers and cultural differences to ensure equitable care for all. We tirelessly advocated for vaccines, disseminated accurate information, and debunked all the myths. And for that, you should give yourselves a good round of applause. On this day, let's recognize our achievements, our resilience, and impact we made on our communities. Our work often goes unrecognized, but the lives we touch and the communities we touch are remarkable. They may not recognize us, but you recognize yourselves every day when you wake up and look in the mirror. You know the work that you've done. You know the work that you provide. You change lives. You inspire health behaviors and create a ripple effect that extend beyond individuals we serve. Therefore, I'd like to take a time to pause and thank, hopefully, our chairman, finance chairman, Jay Edwards, and supporting the language creating the Center for Community Health Worker in the upcoming budget. As you travel through the office of my fellow legislators, I want to remind them, this is not just an investment in Ohio, but investment in you. An investment in community health worker services, an investment that you would carry on to not only help yourselves, but others. Let them know how it affects their communities, because the constituents they represent, their families, their friends. Let them know the work that you've done and how you did it, the barriers. Don't let them cut you down with all the myths and cut you across when they say, well, it's not going to help. You know your work. You know what you do. You know where you've been. And the only person can tell that story is who? You. Don't go in their offices and let them tell you their story. You tell them your story. When I was on the campaign trail, one of the things I always say when I come down here, I want to make sure I tell the story, to show the story. And so that's what I'm asking you today. I'm emboldening you as you walk to these offices. Don't be intimidated. We're just like you. We put our pants on one leg at a time. So you are our lights today. Just know the investment with the Community Health Worker Center will cause deployment in community health workers and disaster relief. It will implement statewide diverse multi-sector technology enhancements and referral and support for community health worker training. And lastly, one of the things I pledge to do as the freshman legislator, and we already have this in works, is asking this legislative body, the 135th General Assembly, to recognize the first week in June, specifically June 6th, as Ohio Community Health Worker Week. So that will be forthcoming. I plan to introduce that soon. So then once again, this is where I'm going to need everyone's support. Once again, I need everyone to go out and advocate for what is right. On a personal note, as a community health worker, when I did this, I didn't know I was stepping into. And she read all the acclimates that I may have. And I guarantee you, you probably did more than I did. But it's about the communities that we serve. As I look out in this audience, I see a diverse community, religion, sex, whatever it may be. Make sure when you go into these offices today, you portray that. You tell that. You tell your story. As you heard from Dr. Angela, as she came up here, I guarantee you, she gave you some inspiration. She gave you a whole lot of inspiration. She gives me so much inspiration sometimes, she just don't understand. She's a tough act to follow, you know, but remember our words, remember her words. Remember the words of the people that you represent. Remember the lives that you touch. Tell that story today. Not only today, tell it every day. Remember the work that you do is valuable. As I sit in these committees, I make sure as they read off the list of partners that they include community health workers. Today, HB7 is on one of my committees. I'm gonna make sure I sit in the committee, put community health workers in there. It's my role to advocate for you all. Thank you so much for all the work that you do. Anything I can do to help, please let me know. My legislative assistant, Jersey McClinton, is right there. Many times you'll probably get him before you get me, but just know his voice is my voice. Your voice is my voice, and I'm here to serve. Thank you.
Thank you.
Any questions? Any questions? I don't know. Any questions? I'm sorry. I always do that. No question. I gave all that. No questions. Wow.
I have one.
Yes, ma'am.
What are some similarities that you see from your work in the field in like dealing with all kinds of clients, maybe convincing them or, you know, lobbying, right? Them to make a choice that would better their lives? And do you see any similarities with how you work with your colleagues? Lobbying them to maybe make a better choice.
Well, it's all about making better choices. Today, as I leave here at 1 o'clock, I am going to advocate for House Bill 175, which is lockage of storage devices when it comes to guns. So I have to convince this committee that this is the type of legislation that needs to be enacted. Not only that, I have another piece of legislation, HB 189, which will provide sales tax exemption for gun and safety devices. While the other side, I'm not trying to get political, has another bill with sales tax exempt on gun and ammo. So once again, I have to convince my colleagues, like you have to convince your people that you serve, which one is better? Which one will save lives? Which one will be the best option for your community, for our communities, especially communities that look like me? We have to make sure that we are represented 110%. Have to make sure, because I'm the freshman of the group, and that's why I'm so happy that Representative Jay got this in. Got Edwards was a champion with this community health worker bill as well. We have to make sure that we advocate for what's right. So go back to your question. It is hard, but we're community health workers. We're tough, right? We know what we're doing. We've been there. We go to those communities that nobody else want to go into. We hit those doors that nobody else want to hit those doors. We go to those places where nobody else want to go. That's why we're called community health workers.
That's great.
Thank you.
Any other questions?
Yes.
Are you sensing any resistance to HB 33 that we should be aware of?
Right now, we don't know because it's still over in the Senate side, so we'll know in a second. I heard it's supposed to be released today.
Yeah.
So as you go to the Senate side, please make sure, once again, you tell them that this will not only help Ohio, but their district as well. Make it personal. Give them a personal story of how you help somebody and how you've been in the trenches and how this bill will help people who are in the trenches. What they need to know is this is an issue that will not only affect you, but them. You got to make it personal. Tell them that story of that young man or young lady that you helped get services to. And if they had not met you, if you had not been that light in their life, what could have happened? So please make sure you do that. Thank you.
Okay, Hilton Bank representative.
Thank you. Oh, got your shirt. Thank
On behalf
you.
of all of us.
Thank you.
Yes, come.
Oh, great.
On this
I used to be an 8. I'm like, get the 8.
Right, doesn't matter what, doesn't matter, doesn't matter.
I was
Come on, Director Dawson, you might come in and say. Thank you.
Thank you, everybody on WebEx. I hope you are enjoying this.
Yeah,
Wanna go through the packet?
Yeah, I can go. Get it.
Okay. We're gonna go through the packet. So if everybody, if you registered,
Yes.
Carrie Baker actually went through line by line, everybody's address to figure out who their legislature was. And, Heidi's
take it
gonna,
away.
yeah,
Do we want to say goodbye to our Zoom friends now? Because we're doing our
Yes.
legislative day. Okay. Bye, Zoom friends.
Bye.
Oh, here, we should show them the whole. Show
Yeah, I'll
everybody.
show you around.
All right,
Okay.
everybody say goodbye to our Zoom friends statewide. Okay.
There we go.
Yay, okay.
Thank you all.
Close it. Bye, friends.
End.
It's the virtual world is so weird now.